If you opt for a hospital birth, you can still make your surroundings feel more like home, so you can feel more relaxed and in control.
In some hospitals, they've done a lot to improve the environment, and certainly the NCT's Better Birth Environment campaigns that we've had over the last couple of years, I think, have helped hospitals to take a different look at their rooms. Okay, so here we have a fairly typical delivery room. I suppose the most important feature is the bed, which is dominating the room, and that's so typical of many delivery rooms. This is the resuscitaire, if it should be needed after the baby's born, if there are any problems with the baby breathing or needing to be sucked out or have extra oxygen. There's the cot with a heater over top waiting for the baby. This room actually hasn't got a big monitoring machine, but some units would have a very large monitoring machine right next to the bed. It's very clinical looking, really, so there's not a lot of space for people to do things like moving around and rocking and all the things we've been practicing in the classes, and I don't see a ball anywhere or a mat that can go on the floor. It'd be quite hard to push the bed out the way even because of all the other equipment, so it's actually not really a very good, nice environment for encouraging straightforward birth.
Went and looked around the hospital and it just seemed very grey and very clinical, and for some reason she showed us the different machines and equipment that might be used, which I suppose maybe to allay fears, but it didn't, it just made things worse.
As soon as you walked in the room, you just got the idea that you were a patient, and you would just lie on the bed. You know, there was very little room around for things like, you know, birth balls or any other kind of equipment.
When we went to look around the birth centre when they decided to take first-timers, it was just like home from home. You know, down to the bedding and there being a comfy chair and the birth balls and pictures on the wall and colour.
We encourage women and their partners when they go on a tour of the hospital where they're going to give birth to actually look at the room they're going to give birth in a bit more critical a way, and actually think about where is the bed, and ask the midwife who's doing the tour, is it possible to move the bed off to one side? Do you have balls and bean bags and mats that we can have? Is it possible to have some of this equipment moved to one side or out of the room? Quite often the midwife will say, could you just pop up on the bed while I examine you and see how far on you are in labour? And many women say, that was it, I never got off the bed again. We've just moved some equipment to make it look a bit more spacious and a bit more homely. We've moved the resuscitaire outside the door. It's right there if people need it, and it's very often not needed, but it's actually out of sight. It's about people just having that eye for, you know, what do we need and what do women in labour need, and actually creating the space that women can use, so that, for example, they could be just sitting on the ball and rocking during contractions, much more sort of comfortable environment than laying flat on the bed. Women can actually move and kneel on the bed, kneel on the ball and be rocking. Partner sitting there listening to some nice music, much more comfortable way to be giving birth, and certainly in labour, than lying on a hospital type bed, which is not terribly comfortable.
So, if you aren't going to be at home, talk to the midwife about making the delivery room feel more like home. And of course, you don't have to be on your own. You can choose who comes with you as your birth partner.